here, while the lockdown initially had a positive impact, the effects were predictably limited. Our only strategy going forward now is to ramp up screening, testing and tracing, and also do whatever it takes to actively suppress the pandemic through targeted measures. Joining us for this discussion on exactly what that means, Professor Alex van Den Heever, who's the chairperson for Social Security Systems Administration and Management Studies at the Wits School of Governance. Thank you very much for your time on Flattening the Curve, Professor. It doesn't help that we went into hard lockdown before any deaths happened in South Africa. Has it lulled the citizens into a false sense of security, thinking somehow that COVID-19 has been dealt with before it has actually even properly arrived?
Yeah, I think we've got a lot of confusing signals that impact on us. Firstly, the lockdown should have had an impact on the trajectory of the epidemic. And even during level 5 and level 4 of the lockdown, we were still seeing increases in new infections, which, if you had to look at other countries and other contexts, didn't occur. When they introduced their lockdowns, they reduced the new infections. So that's the first problem. And then the second issue is, and that's largely because the lockdown doesn't really work in the South African context. You have to use other measures to achieve the suppression of the epidemic. And those are the measures that we should really be emphasizing now.
What exactly was the alternative to a hard lockdown? And lead us through these measures. In layman's terms, what do they mean for those of us that thought lockdown would have been the best way to try and suppress the curve and indeed suppress infections?
Yeah, so quite simply, the lockdown is intended to kind of separate the people who are infected from those who are uninfected. And it keeps and it prevents certain people who are infected in some communities from seeding infections in other communities. So it's a very blunt instrument. So our sort of densely populated communities and the fact that it wasn't really possible to lock down many parts of South Africa meant that what we actually have to do is have a much more targeted approach on areas of very high risk. We have to maintain a general framework of social distancing and sort of health protocols in key settings such as employers, restaurants, areas of business, all those areas which connect households, where households are connected to each other via communal spaces. Schools as well. Now, the problem is that it appears that we haven't really been effective at doing that. And now it's difficult to tell where we've been ineffective. But you essentially have to prevent people being in the same airspace. So ventilation in buildings, being sort of in close proximity to people who are sort of essentially breathing the virus into the air is quite critical. It's not only going to be cleaning surfaces. So there is a question as to whether or not we need to very carefully look at where these new infections have come from and why. And I'm not sure that that is happening.
Do you believe that the South African government's tracking and tracing strategy has been effective at all, or has it largely proved ineffective in terms of keeping a tab on numbers and infections across the entire country?
Our strategy has been ineffective. So initially, South Africa had very few test kits available for this in the beginning of March and April in the public sector. The private sector was doing most of the testing and is still doing most of the testing. But the problem now is that we are actually testing at levels that are probably equivalent to suppress major parts of the epidemic if they formed part of a unified strategy. The private sector has apparently had absolutely no difficulty in being able to ramp up testing, but the public sector has plateaued and is in fact in decline. And the problem is that the private sector doesn't test according to a prevention strategy. They test defensively. So the question is whether all of South Africa's testing capacity is being used properly for a coherent strategy. And this is where I think we are failing. We seem to have enough tests available, but they are not part of a single cohesive strategy. On contact tracing, it's very unclear within the different provinces how capable those departments are at managing a proper contact tracing regime. And that is absolutely critical in this kind of epidemic. There's no substitute for it. contact tracing and testing are the ways in which you surgically identify the people who test positive and separate them from people who are negative. If you don't do that at sufficient scale, then the epidemic will get ahead of you. And that's really what we are seeing in certain contexts, Eastern Cape and Gauteng at the moment.
Professor van den Heever, what do we do now on the final day of June then? And indeed, how realistic is it for government to now change its strategy or change tack in terms of its approach to dealing with COVID-19?
Well, I don't think that it needs to change. So firstly, the question is what would be a change? On the one hand, I don't think that it would make sense for South Africa to go back into generalized lockdowns. That the damage that is being done to society and to the economy is so severe that we will struggle to recover from that. So it really means that we have to focus our energies on identifying the hotspots and making sure that we contain them with very effective and efficient strategies. So in the Western Cape, that really was their strategy. They ran into difficulties because they were relying on the National Health Laboratory Service to provide them with test results, and the turnover was too slow for them to actually get a preventive effect. So they retreated to a more defensive strategy. We have to take our system forward, get to the level where we can again start to use these strategies to pull the epidemic back. But we're not there yet. But that is really our only strategy, focus strategies on the hotspots.